Good afternoon, everybody, and welcome to today's webinar. Thank you so much for taking the time to join us today and listen in on International Women's Day. Please note that you can listen in Arabic or English, and you can choose this at the bottom of your screen. There should be a language interpretation option. My name is Kristen Meager, and I co-lead the Women Leaders in Health and Conflict Initiative, which is supported by the Research for Health System Strengthening in Syria project. I will be co-chairing today's event with Muzna, who is a gender and global health research consultant and Syrian activist who has been actively involved in supporting individuals and organisations during the earthquake response from the UK. Today, we will be speaking to women in northern Syria and southern Turkey who have been involved in and supporting the 6th of February earthquake response that devastated the region. We know that unequal power relations, inequalities, and discrimination mean that women and girls are often disproportionately impacted by crises and conflict. Yet to date, there has been very limited focus on what the impact of the earthquake means for women, children, and vulnerable individuals in a context already impacted by protracted conflict. Today's webinar aims to highlight these critical issues, amplify the voices of women, support individuals on the ground through advocacy, and explore recommendations to improve inclusive responses in compounded crises. Our speakers will discuss some of their recent experiences, which will shed light on the gender dynamics and explicitly the impact the earthquake has had on women. They will reflect on why women and gender-inclusive responses are critical in these compounded crises, the health impact, again, especially for women and families, how local organisations and women in particular are navigating the challenges that are associated with working in different areas of control in Syria, and of course, what localisation means in practice for these women working in the earthquake response. This will help us to explore how women are navigating gender bias and developing their own role and identity within this crisis. Today, we are incredibly privileged to hear from a group of inspiring women working in the region. Firstly, Fatima Al-Obeid, who is a volunteer with the Syrian Civil Defence, also known as the White Helmets. She's been working with them for the past 7 years. Fatima has participated in the earthquake-related efforts and in the aftermath of the earthquake civil defence operations. We're also joined by Dr. Hala Alghawi, who is a Syrian physician and currently a program and advocacy consultant at MedGlobal. Dr. Alghawi is also a co-founder of Syria Bright Future and Families for Freedom. We're also joined by Abeer Aryan, who is a women's rights activist who's currently head of Athar Farasha for Development, which is a women-led local initiative in northwest Syria. And we were supposed to also be joined by Muzna Jundi. Unfortunately, she won't be able to join us today, but we do hope to hear from her at our future events. Lastly, just a few brief housekeeping rules. This webinar will be moderated for about 40 minutes, 35 to 40 minutes, and then we'll ask for questions from the audience. So I request that audience members please turn off cameras and microphones and remain on mute throughout the panel discussion. You can use the Q&A function to ask questions throughout, and we will come back to these at the end. We'll also use the chat function to provide some resources and further information on how you can support those affected by the crisis. This event is also being recorded and it will be shared following the event today. Please do note that this is a safe space for our colleagues and friends who have suffered during this catastrophe, and we therefore request that questions or comments please remain on the points that we've mentioned and what we are focusing on, and that any questions are respectful given the current context. I will now hand over to my colleague Mona, who will be speaking in Arabic, so you might want to ensure, if you're listening in English, to switch over. Thank you, Mona.
شكرا. شكرا كثير كريستين.
Thank you very much, Christine. And thanks for those who joined us in this webinar. I will start with Fatima, and I hope that you will be able to hear me and that the connection at your end is good enough? Yes, yes, I do.
الله يسلمك يا رب. وحابة أعرف شوي تفصيل عن عملك كمتطوعة بالهلال عفوا
I
بالدفاع
would like to hear
البيضاء عفوا.
more about your work in the Syria Civil Defense White Helmets. All of us know that the White Helmets are the only team that conducted search and rescue team on the ground with machinery and equipment that's specializing in this. Can you summarize to us the work and the role of the White Helmets women volunteers and how important it is that there is a response that is inclusive of women in this critical situation in light of having a conflict and a natural disaster? Thank you very much, Muna. First, the situation in Syria has already been a conflict and war situation. Local organizations at that time should have done something, which is to help people in northwestern Syria. Local teams work on rescuing people based on that. The Syria Civil Defense volunteers, men and women, gathered together and formed teams to help recover civilians from under the rubble. They were trained through different training courses that will help them perform the work in a better technical manner and in a better professional manner. Now, let me speak to the disaster that happens about a month ago. It happened during the first hours of the morning at 4:17 a.m. Turkey time. During this time, people were living in their houses, and this is one of the reasons that our teams have responded since the first minute. When I first heard the bangs of the earthquake from the ground, I thought that it is a bombing by the regime forces and the Russian forces. But when I opened, when I took my mobile phone to call my friends, colleagues, family, I just realized that it was a natural disaster, i.e., an earthquake that hit northwestern Syria in different levels. And when I arrived, when I got the news through the newsrooms, online newsrooms, we knew that it is a natural disaster, and our volunteers, men and women, have been on full alert. First, I knew that it was an earthquake, but when I arrived at the incident location, at the location of the destruction, I didn't expect to see this much devastation. Entire neighborhoods and entire buildings on the ground, women and children crying. People are around the rubble. They're looking for their loved ones. Some are looking for their children, for their siblings, for it's like doomsday disasters that Syrians went through. Men and women volunteers have responded as the beginning. We transported the injured to the hospitals and the medical points. We participated in the recovery of the dead bodies and the rescue of the people who are stuck under the rubble. And at the same time, the weather was harsh and cruel. There was a storm that was taking place, and the information the equipment and the hardware and the machinery that we have is not enough to handle this crisis. So this disaster. So we called on the international community, the international organizations, and other parties to support us in these critical moments in order to save the largest number possible of civilians. Fatima, can you mention to me, you as women, what are the challenges that you have faced while being present in those areas? How did you participate in these efforts? It was really distinguishing to see these women featured in these videos that are coming from Syria, to see women present during rescue operations. What are the challenges and what are the opportunities? How did the community accept you participating in these efforts? At the beginning of our volunteer work in the past, civilians didn't know the nature of our women Syria civil defense teams. But when they started to realize and be aware of the services, including the first aid, the routine care for some diseases and the camps, and the nebulizer sessions that we would give to people, and the awareness sessions that we will provide to civilians about their dangerous environment. And we conducted lots of awareness campaigns on cholera and other diseases. As for the earthquake, the response was in two stages. First, there was the urban search and rescue. People started now to open the road for the women volunteers. They started to appreciate the work that women do as volunteers in the White Helmets / Syria Civil Defense. Cooperation with women volunteers is easier for them sometimes from dealing with men volunteers. I'm here, I'm speaking about women in particular, because when the earthquake hit, people were taken out of a sudden and they were sleeping, so they were not, some of them were not wearing like decent clothes, so it was not easy for them to deal with men. It was more appropriate for them and more comfortable with them to deal with women volunteers. And the second thing is transporting people and evacuating them to shelters that were a first response solution, but they are not specialized to do this. So and we have the elderly who have to take medicine at specific time, and those medicines and drinks remained under the rubble. And we don't have health infrastructure because of the bombings by the regime and Russia. Many civilians left their homes without their clothes. Many families had no choice but to sleep under the trees. They don't have the price to pay and buy a tent to sleep under. All people think of homes as the safe space. Having a ceiling and walls is the safe is a safety, but after the natural disaster, it's not anymore. It's a threat of death. And at 8 p.m. another aftershock happened, and because of the panic, some of them lost consciousness. Some civilians dropped themselves, threw themselves from high up stories or high-rise buildings because they don't want to be killed under the rubble. Some people just chose to sleep outside in the street, under the trees, in the open, because they do not want to go back to the situation of the earthquake. Can you briefly tell me about your needs as volunteer women to support you personally and to secure support for the community? I would like to speak about women's needs in northwestern Syria. They need shelter. Children need baby formula. They need all the needs. The Syria Civil Defense needs fuel for the machinery. We need support for the care that we provide for the pregnant women. We need specialized medications for women and for children. We do not have them in our centers yet. Thank you very much indeed, Fatima. Thank you for summarizing the needs that are that are needed on the ground. You told me that you are on duty today. We are very grateful for having you with us. We appreciate your interjection and answering our questions. Thank you very much indeed for being with us. Now I will move to Dr. Hala. Dr. Hala is a medical doctor and an advocate for women leadership in humanitarian settings. Dr. Hala, are you with us? Yes. Good to see you safe and that your family is safe. Doctor, as you are a specialized medical professional and based on your work in humanitarian response and the coordination efforts and the advocacy work in leading women in healthcare in Northwest Syria, can you please tell us mainly about the medical needs for supporting women on the ground? Thank you very much, and thank you for selecting this session where we will have participation of different viewpoints from different women. My perspective will be medical. The Syrian disaster and the Syrian crisis is not that of a natural disaster only, or not a war that's man-made, or just like an explosion in a factory. It is a complicated, complex disaster. Our communities are already harmed and damaged because of continual bombardment for more than 11 to 12 years, and then it was struck by a natural disaster. So we cannot imagine the size of the damage with having other issues like poverty and others in the humanitarian situation in particular, and other services in general. So we have some sort of partial stability that turned the host communities that hosted large numbers of displaced people, turned all of them into displaced people. So all of them, the host and the hostees, the hosts and the IDPs, turned into damaged and harmed communities. We cannot really imagine the scale of the disaster that resulted from the earthquake, from the conflict, from the war, from the bombardment that took place for more than 10 years, or sorry, 11 to 12 years continually. Women's needs are massive before the natural disaster and after it. They are the medical ones that all family members need, whether they are children, males, females. It is the routine checkups, the temporal diseases, or the chronic diseases, or the early discovery of diseases such as cancer, and any other services that people, including men and women, males and females, need. And then we have the motherhood health, which is not understood, is that it is that we have to provide for the woman who would like to give birth. They don't think about the prevention. They don't about the other aspects. Its definition is that people are that peoples will have the physical, mental, and psychological well-being to exercise their life normally. It includes all women starting at teenage years and until they become medically fertile. Many studies in WHO and other organizations and UNFPA, all of them issued reports that women deaths that result from disasters or in a complicated emergencies, just like what we have in Syria, that women's deaths and the death rate of newborns is high. And because of all of this, and because people are in camps, and because of all of this, it's complicated because of what happened before it, because of the weak infrastructure, the unavailability of information, the inaccessibility to the service, and if available, receiving a service that's not adequate. And we have marginalized groups, including the elderly and the handicapped. Now, when it comes to psychological and mental health, during a crisis and a disaster, just like the earthquake, everybody has been affected directly or indirectly, men or women. Those individuals have lost their family members or just witnessed this devastation, or people who lived in these areas, they will suffer a lot, just like the White Helmet volunteer said, people have been struck by panic. They have complicated traumas that they have accumulated with the displacement years, with the conflict, with the war, and they need years to recover. We imagine this, and I wish that Fatma would have said that would I wish that Fatma had spoken about the needs that those staff, the Syria Civil Defense women, need, because they need psychological services, they need self-care, because the traumas that the service providers are subject to is worse than sometimes the trauma that normal people suffer from. Therefore, we need to support women and support service providers and first responders because of their emotional support to their families and to their children, and their expression to it is more. Therefore, they need more support, particularly because they need protection services, psychosocial support services, medical services, and then they were struck with this natural disaster. Frankly, this thing, and it's briefly said, there are needs for women and for children, and they are not related to the reproductive health needs. The psychological support services must include everybody and must be provided to everybody. Then we will move to assess the situation, to assess the damage and the harm that everybody incurred. We have noticed also
we lost a lot of persons at just the golden hours, the very first hours. I am a surgeon, and I know what does it mean to have a patient who would be bleeding for a couple of hours until we managed to raise the rubble. So thankfully, at least with the very limited resources of the white helmets, we managed to do what we could, because the situation was an emergency which might go beyond even bigger states to handle. You have seen Turkey with all its capabilities, and it asked support from different countries in the world. Unfortunately, in Syria, we were not advantaged or privileged to get this support. Most of the aid even channeled through the regime-controlled areas. And by the way, what we received in terms of aid was already scheduled, and it did not help that much as a response to the disaster in Syria. A last point, I'm not sure whether we can fit it in. Communities are not being consulted regarding the priorities. I completely believe I'm all for the mental support, but sometimes the first mental support aid might be different. It means that we need to check the priorities. We have heard a lot about women group and from the teams on the ground that people did not want anything in terms of mental support. They were behind basic needs. People needed tents to protect their loved ones, their children, to have a roof on top of them. So most of the providers and beneficiaries, we have seen that their needs were exacerbating and the gap was just getting wider and wider because their priorities were not taken into consideration. We have seen a lot of local and initiatives, but they helped. However, when we speak about the international, the UN response, it was quite limited and it did not live up to the level of the disaster, the catastrophic consequences on a society which has been already in need and lacking. But from a medical perspective, if I am to talk about the consequences of the deteriorating infrastructures on the health care sector in general, when clean water are not available, access to clean water, we have a surge in cholera and leishmania, and many cases, even the basic needs for women, which can't be quite helpful in terms of protection, are now lacking. Hygiene kits are missing, special needs for women are all lacking, with all their negative consequences given the contaminated water, lack of clean water, and the lack of wash services. I hope I covered.
تعملي advocacy متعلقة
Yes, doctor,
بقيادة
thank you very much. I know you quite well for the as an advocate for the local leadership for women in Syria, certainly in the healthcare system and the medical, of course, and the health sector. If you would also talk us through from your perspective about the importance and the significance of reinforcing the leadership of women, whether at the local level, at the local response level, and perhaps at a wider level, so that we can redeem or fill the gaps in women's needs. Yes, true. I mean, this is the major concern and the major challenge which I've noticed in the medical sector. Many of the voices of the women, voices in the healthcare and the medical sector, we see them, most of them are invested in the protective aspect. But when you look at who are the leaders, you would see men are the leaders who put the plans, implement programs which are aimed at women and their medical services. Always the availability and the inclusion of women in any medical related programs at all stages, whether planning or implementation, can be quite helpful in ensuring, facilitating the access of women to medical and healthcare services. In many cases, medical cases for women, whether imposed by their societies, their communities, at some point, some women who are struggling, who are patients, would reject the service because of its providers. So, I mean, when women are left alone with no supportive voices with them in terms of their needs, are lacking. It is quite important to have networks for those women who are working in the medical sector in order for them to have a sort of networking and solidarity in order to deliver the message and the needs and the demands of their fellow women, whether at the level of the coordination with the OCHA, with the UN agencies and other actors in this domain, or at the level of the WHO. So the inclusion of those people, of these women, are quite important. This is about the theoretical level. When we look at how this is implemented, we see it is quite lacking. There is a level of insufficiency in terms of the inclusion. So some would argue, I usually argue that the, the, the the health care related to women is limited or reduced to the reproductive health services. No, it's not. Women have too many other health care and medical issues need to be brought under the limelight. I've seen a lot of cases in Syria, and thanks to the late detection and late identification, whether in the breast cancer or any other diseases, we have seen a lot of failure because the focus is usually shifted towards reducing women health needs in the reproductive health services. So again, I will underscore and stress the importance of women's role in the healthcare and medical sector. And unfortunately, it is under covered right now at the moment. I wanted to ask you about the importance of strengthening the health sector in northwest Syria, because those who know the situation in Syria know very well that cancer patients usually get transferred to Turkey in order to take their treatment. So over the last decade and in light of the vision, the limited vision of the donors towards addressing this particular aspect, would you talk to us about the importance of advocating related to reinforcing and strengthening the healthcare sector and medical sector in northwest Syria? Exactly. I mean, unfortunately, there is a reality in Syria. We have to acknowledge that responses usually, even by the UN agencies, is usually carried on at the high level meetings, is usually carried out away from those with first-hand experience on the ground. The lack of a central hub or body to identify the priorities of the society also are lacking. As you have mentioned, sending patients to Turkey, for instance, a service of anatomy might need for samples to be arranged through Turkey just to analyze, to arrange an analysis for a patient who have given a sample. Many children are being transferred to Turkey because of the fragile and the weak status of the medical system in Syria. Over the last decade, there has been a conviction that, or a reality in Syria, that we followed the priorities of the donors, which were focusing on the emergency response. So there should have been more focus on specialized services which had to do with wide swaths of people. So now we realize that the lack of a central hub, a central body in Syria to assess these needs, whether in terms of equipment for hospitals or in terms of advanced medical education. I mean, that's why we have see efforts in silos and fragmented. So this is what happens when a lack of leadership is present. So unfortunately, who are paying the price the most marginalized segments of the population and of people. And among the most vulnerable would be children and women, of course. So it is quite an important aspect that we focus, because a robust medical system now in Syria, we act out of a response approach, but there should be a stage of preparation, planning. It's not enough to just limit ourselves towards the responsive approach, just as first responders. Thank you very much, Dr. Hala, for painting this rather comprehensive picture regarding the medical and healthcare system and the need to strengthen the leadership of women and to bolster the medical system in Syria. Let me move now to Abeer. Abeer, we are quite pleased that you are safe, you and your family. I wish you can hear us. Yes, good evening. I do. So, Abeer, since you are leading a local women initiative in northwest Syria, what are the main challenges you are encountering in terms of limiting your ability to respond to the local community, and to what extent in practice you are able to overcome these barriers in response? How are you managing to overcome these barriers, and to what extent are you implementing the local response term in practice on the ground? Yes, Muna, for us as a women initiative, we tried to respond to women and girls, and at the same time, if we were able to respond to children or to the entire household without any discrimination. We have tried at the beginning to put a response plan, a long-term response plan, which is not a temporary one. So first we responded by mental first aid response, whether to our teams or for women with cases we were already dealing with, and for those in need in the shelter centers. So in fact, there are a host of challenges we are encountering on the ground, certainly in the field, mainly represented mainly in the fact that the society would have its own red lines related to women organizations, which at many instances hinder the response of women organizations, which are usually tagged as being marginalizing the role of men or men. So that's, of course, we try to respond to women through women responders, so that we spare those in need any embarrassment or any difficulties, and in order to score our objective. So our plan, for instance, included first emergency mental health support response. So we have identified a group of women at the shelter centers. So we focused on the need for them to focus on their hygiene needs and supply their needs for over the next coming months. So in the aftermath of the disaster, when you look at the situation, you will see, if you take a look, that those affected by the earthquake are first and foremost and internally displaced people. Women and households are already exhausted. They have been IDPs for a long time. They were just living by the poverty line. So now, yet, there has been a new sense of instability they are encountering, where they found themselves compelled and obliged to rush for shelter centers. And as you might know, these spaces might not be quite safe for women. We have recorded many cases of harassment and risks and threats to women's well-being. So there is a heavy responsibility on our shoulders as women organizations, while at the same time we are limited in terms of limitations in financing, in terms of. So this is leading to weakening our ability to respond, because as you might know, any response needs to be financed, it needs to be funded. So at many instances we act with limitations. We are doing our best, pushing the boundaries within our capacities, despite the fact that the needs on the ground are much, much bigger and beyond our capacities. Women overall in such a situation are encountering healthcare challenges, because as my colleague, my former previous colleague mentioned, that the healthcare system is already exhausted. That's why it's strained with an increasing load of pressure. So even some women who have not even managed to get their first emergency response, no one perhaps would have the luxury to think of their basic needs. So this is increasing the pressure on them, which is increasing the pressure and the stress. This is quite an important point. We have to pay attention. The health of women overall has become number 2 priority after this increasing and mounting pressure on the healthcare sector and the medical sector, which have been already exhausted, as we have pointed out. So yes, it is coming down on the priorities list. Of course, all people in the society were impacted and affected by this disaster. However, women are among the first, just at the forefront of those who have been impacted. Of course, children in addition to women. As I have mentioned, we have tried to put a response plan so that we respond to women and children within our capacities. However, I don't dare say that we have even satisfied the minimum of our aims, given the challenges. Yes, Abeer, I understand, given the scale of this disaster, and you yourselves were survivors of this disaster. And of course, the non-stop ongoing bombardment operations over the last decade. Let me ask you, Abeer, what's the importance, do you think, of focusing on bolstering and strengthening the local teams and initiatives who are carrying out the response and improving the networking and collaboration between these local teams? Do you think it is important to focus on them at this current stage, so that we have a purely Syrian response by Syrian efforts? I mean, certainly in light of the stark failure of the United Nations in terms of response after the disaster. Yes, you hit the head of the nail. This is a very important point. I mean, we need to further the collaboration and coordination between us as organizations, so that we avoid duplication, and so that we ensure that we are providing for all the needs, so that we avoid and that we ensure that we support the same teams who are delivering the services on the ground. So the response should not be approached in a temporary basis. So because those teams who are responding and delivering the response have been already struggling and under pressure. So we need to ensure providing the mental support for them so that we ensure that they keep to deliver and to operate. So we need to ensure the maximum support for them. But when we look at the level and the scale of the disaster, nothing has been provided to us so far to help. So that we need to get the minimum to be able to help people to rise up again. So organizations are exhausted, their teams and staff are exhausted, the entire society is exhausted. Yes, we are trying to look at new mechanisms, new plans in order to stretch ourselves to respond to the need on the ground. However, again, I would like to reiterate and underscore the importance of acquiring and securing the support for those local organizations. Unless we ensure this in place, they would continue to operate with limited capacities. For instance, we have all seen the limitations for those rescue teams because of the lack of equipment. They need fuel, they need a lot of requirements in order to do their jobs. In terms of human power, we have a lot of energy and capabilities, but they need support, they need, and this needs to be coordinated. And of course, there is a need for the de facto authorities to be supportive as well, because among some of the challenge that the poverty or the authority in power might be acting in a completely different direction to that of the local organizations. So in order to ensure the proper response and to ensure that teams are a safe environment for operation needs to be.
فهاي نقطة كمان عم بتصعب بصراحة أداء الفرق على الأرض.
Abeer,
This point is making the work of the teams on the ground difficult. Abeer, I will ask you the last question. What do we need to do as Syrians in diaspora, as Syrian women, as a women platform, and
Yes, I can hear
feminist
you.
platforms
This is
in
Ibrahim through the Arabic
in
channel.
the West, in America, in North America, in
Hello.
Western Europe? What do we need to do to support you? Just like we said a little while ago, we need advocacy campaigns clarifying the role of feminist organizations so that the community knows the objectives of these organizations, the field they work in, the importance of their role for women, especially in these circumstances, because women's needs are diverse a lot and are very peculiar in this specific context. And only feminist organizations and women organizations take care of or tackle these needs. We need to raise the awareness of the community about this, and we need to provide support to those organizations to continue their work, because all of this will help us empower women, meet women needs, because women are always having a specific peculiar situation that's different from others during a natural disaster. I think the points that we have to work continuously on are advocacy and awareness, so that we support the teams that work inside, so that we shed more lights on the positive impact on what's happening, because these organizations, these centers, these stations, these bodies are conducting activities that benefit women, and if they do not work, the situation will be more catastrophic. Therefore, we're trying to find support resources, even if they are temporary, because we are always concerned that there would come a day where there will be no support and those services will be stopped. Therefore, a lot of women will be impacted negatively. This is the main role that women do in general, to keep women initiatives and women organizations and activities active on the ground. Thank you, Abeer. Natural disasters, although they are not genderized, but their impact on women is more specific, and they get women in a more vulnerable of a situation. Women in northwestern Syria are vulnerable, and this catastrophe made them more vulnerable and made their situation more sensitive. Thank you, Abeer. I would like to go back to you, Kristen, in case you have any other question.
Thank you so much, everyone, for joining us today. I think we are sort of coming to the end of our time. So if there are any additional questions or any other comments, even from our speakers, if there was anything else that they wanted to add, please feel free to do that. I think, we've highlighted some incredible points today around the impact of compounded crises, and that it impacts everybody, and we know that, but without the voices of women, there will remain a significant part of the community whose needs may not be met. So again, thank you everyone today, and I hope that being able to use your voices through this platform, that we can provide some further advocacy and support both at the community level and at the international level. We know that the international community does need to do more, particularly in light of this crisis, but also the whole international community needs to do more in regards to, equality and advancing the role of women and the rights of women around the world. So if there's no further questions, or Mona, did you want to add anything?
I just want to add that the scale of this disaster requires an organized collective work from individuals and also from nation, in addition to put pressure on the UN system regarding the humanitarian landscape in Syria. And also it's quite crucial for us as colleague and as team to keep pushing to decolonize the academic landscape regarding dealing with this catastrophe, to push forward to include local women, to be in the center of any discussion around the response and the impact of this disaster.
Thank you, Mona.
Thank you.
Thank you everyone for joining. Sorry. Thank you so much for joining, and especially given everybody's circumstances. Thank you again. We'll be circulating this, and we encourage people to share this.
Thank you very much. Thank you.
Thank you, everyone. Take care.
Bye.